4 months ago, as the country was recovering from the effects of the deadly COVID-19 disease that had affected the country, the public was thrown into a panic situation when another deadly virus was announced.
Trying to gather all the information as we got the results last evening. So we shall be providing this update more regularly, and we shall also be able to tell the country where we have reached. But we're also going to issue further the SOPs, the guidelines that the public need to observe.
After the Ebola outbreak has been contained, the Ministry of Health is set to declare the country free of Ebola outbreak. The declaration will be made in Mubende district, that was the epicenter of the outbreak.
I can't say what the minister will say, but what the minister will most likely say is that the current outbreak is over. But what I think she will say, what I don't think she will say is that Uganda is Ebola free. But what she will say most likely is that the current outbreak is over.
The Ebola outbreak that had flared up from Kasanda and Mubende districts had previously put the Ministry of Health and the country generally in a panic mode. The Director of Public Health in the Ministry of Health, Dr. Daniel Chabainze, explains the procedures followed to declare the country free of Ebola outbreak.
To declare a country Ebola free, we declare it in terms of the epidemic free. We have 2 incubation cycles, which are 21 days from the time which we count when we last discharged a patient with Ebola. So from Uganda, we are making 42 days, which is 2 cycles on Tuesday, which is tomorrow. So after that day elapses, the following day, the country is declared epidemic free. However, we cannot say there is no Ebola in Uganda because Ebola still remains in the wild, in the reservoirs, so we can only continue doing surveillance, but the current outbreak will have come to an end.
Since September 2022, when Ebola outbreak was declared in Mubende district, several interventions were deployed to control the spread to other parts of the country.
Further, we also had limitation of movement. We are talking about the limitation of movement in Kasanda and Mubende. This was very vital. One, it reduced the extent to which people were mixing. It also reduced the extent to people how long they were moving from one place to the other. And then 3, for example, in Kampala, we had what we call institutional quarantine. And that's why we were able to get that seemingly big cluster in Masanafu in the family. So by getting these people early on, we were able to limit further spread. But as I said, in public health, no single intervention can be effective. But it's a very critical intervention, a single intervention, which has the biggest impact.
The 2022 Ebola outbreak registered 55 confirmed deaths, 22 suspected deaths, and 87 recoveries. Adiana Kote, UBC.